We're back again, Dr. David Samadi from Lenox Hill Hospital. We have a very well-known nurse in our show. Donna Cardillo is with us. We're excited to have you, Donna. She's obviously a huge advocate of nurses out there. She's a motivational speaker. She's been on the stage talking about the role of nurses and how nurses not just work for you, but nurses work with you, and they're a partner of doctors and surgeons out there, which I always believed in that. In fact, if you look at my talks, whether medical talks or any kind of talks I've given in the past, I've always recognized the role of nurses. And I don't know if you know or not, I was at a different hospital before I came to Lenox Hill, and the bond with my nurses and medical assistants and all the staff were so strong that everybody followed me. And that's a partnership. And I always have seen the nurses as partners. You guys are in the front line and you're taking care of the patients. And of course, I get all the credit, so that's okay with it. But Nurses Week is coming up in May, and it's a pleasure to have you, Donna.
Thank you, Dr. Samadi. My pleasure to be here.
So tell us about, what's going on with the role of nurses. And you said you have 11 ways and places that nurses work for you and with you.
Yeah, there's, people traditionally think of nurses as assistants to the physician, but as you already mentioned, we're actually partners in healthcare with a separate but distinct, both with a very vital role in healthcare. So while many people think of nurses working in the hospital, only about 50% of us work there, but the rest of us work in a lot of other positions. So, for example, when people come into the hospital, just to use that as an example, they really come in for nursing care because nurses are there 24/7, very close monitoring of everything that's going on, noting any subtle changes that are occurring. And sometimes people don't realize that nurses are also experts in things like pain management, in wound management, and even in something we call care management, which is helping people navigate their way through a very complex healthcare system. When you think, for example, if somebody gets a diagnosis of cancer, there's so many different complex components to that. And many nurses who have the title of nurse navigator, care manager, help people navigate their way through that, just as an example.